Hey everybody, it's Kevin and it's Jackie from Perfecting Peds, and we're on the Perfecting Peds show with our PH allies. So excited to have you guys this morning. Jackie and I have a fun topic to go through. It's a two-part series, so headache is going to be next week. We're talking about constipation today, and as Jackie and I were talking offline, is such a common thing to run into for pregnant women and can be very frustrating and difficult to deal with. So learn about how to take care of your patients, and if you were a pregnant individual, think about the ways that now you can take care of yourself. We'll talk about kind of everything inside of the subject, get a little bit of knowledge and have a little bit of fun. We'll see you right after this. Jackie, such a pleasure to have you with us today. I'm so glad that you're able to make it. Like you and I were saying, I love the living room in the background for you. I need to make the upgrade for me. I know everybody does on those shares. But Jackie, whenever Jenna tells me that a colleague is going to join us, I'm always excited because she has brilliant colleagues, and you're no different. Can you please just talk about yourself a little bit, intro yourself to the folks that haven't come across you?
Absolutely. So hi everyone, it's nice to meet you. It's great to meet you, Kevin. I work with Jenna with her business called Perfecting Peds. I also work as a retail pharmacist on the side. I had previously completed 2 years of residency and did a second year PGY2 in pediatrics. And then following my residency, I actually worked with Jenna in a hospital for about a year. Prior to deciding to go back into retail, where now I'm trying to expand and help all of our patients, especially our pediatric patients and pregnant women who don't have easier access to a pharmacist with this specialized knowledge.
Amazing. Yeah. One thing I was just really inspired just thinking about in the back of my head when Jackie was telling me, she was talking about her kind of motivation to go into the outpatient setting and make a difference there. And I think it's absolutely incredible. Sometimes we hear about outpatient not being clinical, and I feel like that could be as far from the truth as possible. Like if that has to be the epicenter of clinical information, and that is where we really make an impact. No one wants to be in the acute care settings and see us there, Jackie. So much better to be able to take care of them well and keep them out of those facilities if possible. But one thing that can land some people into some real problems is constipation. I seen it from the geriatric side. That we have individuals that are being admitted for impaction and other issues that are happening with them. I know on the pediatric side, it can be a problem that a lot of babies are coming in and taking care of these things. But for pregnant moms, not only an inconvenience of just, oh no, this doesn't feel great or it's uncomfortable, but can be a medical issue. Can you tell us more about it just in general, Jackie, and kind of introduce the topic?
Yeah, absolutely. I feel like it's so common for patients to come in, especially since it's not something that's as easily accessible. Patients usually come in and ask, like, I'm pregnant. I don't really know is this safe for me to take or is it not? And they're always looking for recommendations when they come, especially in the retail setting. So constipation itself is something that affects up to like 40% of women who are pregnant. So it's something that's really common and to be expected when you're having all of these different hormonal changes, especially in your third trimester when the fetus is growing and you have increased pressure on the bowels. So this is something that usually happens, is considered whenever you have less than 3 bowel movements in a week is when we get concerned with pregnancy constipation. So there are different things that you can do, especially non-medications that can actually help manage as well as prevent pregnancy constipation within pregnancy. So one of them being dietary changes. So something as simple as increasing your fiber intake. Now, this is something that we usually recommend for patients who aren't even pregnant who are constipated, is to try and increase their fiber intake because this helps not only manage but prevent it as well. So it's usually recommended for pregnant women to consume at least 25 up to 30 grams of fiber today. And this is natural fibers, things that you can find in different types of fruits, different vegetables, whole grains, and prunes. And with that, we also encourage patients to drink plenty of water to help them stay hydrated because this will help make your bowel softer and make it easier for you to pass the stool itself. So drinking anywhere between like 10 to 12 cups of fluid each day with combining that high fiber diet is really one of the best and easiest ways that you can help combat constipation. Something else that can also help it is just having regular exercise. As you can see, Kevin had pulled up here the American Pregnancy Association, which is a great resource for patients to look up online, and it has different suggestions as to things you can do to help combat constipation as well. So, as you see, third on the list is exercise. So, regular exercise can help these patients stimulate their bowel movements and help prevent constipation. And something to consider, all of these should just be like low impact exercises. So, like walking, swimming, you can try yoga for anywhere between like 20 to 30 minutes a day, is usually what's recommended. And then when you are doing these types of exercises, it's important to take into consideration how much water you are drinking for that. You may need to compensate for that as well, since you may be sweating more or in humid classes. You may need to take in additional fluids as well.
Oh, that's super helpful. So with some of those, since we just went over kind of all the lifestyle modification kind of things that are going on there, when it comes to fiber, the one thing that I feel like happens too often is someone says, you need to increase your fiber. So someone goes to an insoluble fiber and starts taking in an insoluble fiber and goes, oh man, now I feel more gassy and bloated and still constipated with that. So when talking about that in general, I know you mentioned some of the like the options that are available for us to take in natural fibers, soluble fibers there. But what are the recommendations, Jackie, for you for an individual if they're taking like a supplement? What are they looking for when they're looking at a fiber?
So, are you talking in reference to like additional like medication supplements?
Yeah, let's say that they do not like prunes at all. Like that is way on the lowest on their list. They're like, I just want to take a pill or a powder, to be able to help me out. Like, what are they looking for when they're looking at that package and trying to choose something? Or for a pharmacist, what are they thinking about recommending?
Yeah, so absolutely. So there are some types of laxatives that patients can take to help with pregnancy that are over the counter. Some of them include like bulk forming laxatives, which is like a Metamucil. So this is like the closest to like a fiber supplement that helps really like increase the water content, making it like easier to pass. So that's something that you can grab for that's just over the counter. Um, there are some laxatives that you definitely want to stay away from, including stimulant laxatives. So these are like your Senna laxative or your Docalax. Now, with these ones, they can lead to uterine contractions, which could cause dehydration as well as preterm labor. So that's why we want to avoid those while you're pregnant. So reaching for bulk forming laxatives like a Metamucil is what's usually recommended first line. And then after that, you can also try Colase, which isn't a laxative, it's a stool softener, which can also make it easier for you to pass stool as well.
Awesome. Yeah, I think that goes a long way there. So with the Colase in particular, when you're looking at kind of staging or staggering things for a pregnant individual, how do you usually think about starting that off? You said, let's say that my wife has not been able to pass, have a bowel movement for a week or
Mhm.
5 days, depending on how regular an individual is, can depend on when you're kind of a little more concerned, but hasn't been able to go into the pharmacy, talking to Jackie. And what are the first things you'd say, like, here's how I would start? And I mean, this could have been, we're already too far down the road for this example, right? I mean, we are now constipated and we have some, potentially dry stool that is harder to pass. So when you're talking about I guess I'll back that up and say, newly pregnant mom trying to avoid constipation altogether, how would you stage those things, Jackie? Like what do you start with first? And then how do you progress to be able to help them?
Yeah, absolutely. So the first thing I would always try and do is lifestyle modifications, because if you can avoid it, that's what I would do is an additional medication. I would recommend that as well. After that, I would recommend the stool softener, since that's going to help try and soften the stool specifically instead of necessarily pushing it out. And then after that, you can try a Metamucil from over the counter.
Got it. Perfect. No,
If you need to go to something even stronger than that, sometimes they can recommend using Miralax specifically for pregnant women, which would be, I would say, the last line option available over the counter.
got it. When should you see your OB?
I would definitely recommend contacting them if you are experiencing less than 3 stools per week, and you have tried some of these agents and they have not worked.
Okay, got it. Perfect. No, that is super helpful. One thing I was kind of interested in, because it does come from a very reputable source, but I'm thinking this could be tough. And there are some medications that cause constipation that you and I both know, right?
Specifically, I mean, iron is one, and that's in all prenatal vitamins and something that's recommended for pregnant women. So something that you want to make sure is that you are taking an appropriate amount of iron and not too much iron when you're talking to your OB. Another thing that you can also do when it comes to specific iron supplements and iron containing food that a lot of people don't know is that you can take a vitamin C supplement or take a vitamin C containing food. Vitamin C actually helps the absorption of iron, which a lot of people don't know. So if you kind of combine the two of them, you can kind of kill two birds with one stone, and maybe you won't need as much of a supplement.
Excellent. Yeah, and I love that the resource that you passed over our way is really talking about it is not meaning stop it forever. Like there are so many medications that even during pregnancy we can't just stop. Iron can be one of them because of several reasons. But having an ability to either one reduce the dose, take it on a less frequent basis, pause it potentially for a period of time until you get back to regulated, and then add on vitamin C, I think are really important kind of elements there. So thank you for highlighting those. What other things, Jackie, do you want people to know about, especially when they're having issues here? You talked about all the great ones, the fiber, the increased water intake or fluid intake, the exercise components, some supplement utilization, and some of the meds to be able to avoid. Any other things that you've encountered out there, any other patient stories related to this?
Yeah, I think the last thing that you can also do is looking into probiotics, since those can also be helpful as well. So specific probiotics like cultural over the counter can help with gut motility and help prevent constipation as well. So there are specific supplements you can take like a cultural, or you could also look for natural probiotics as well. So I think the most common one that everyone thinks about is yogurt for a probiotic, but there's also other foods out there as well, such as like dark chocolate, which is always great if for someone who's pregnant may be preferred.
That's a big
Someone wants to remember, pickles is also one that contains a lot of probiotics in it as well. So there are other natural ways to get probiotics in your diet to help prevent it as well.
Okay. I was always thinking of yogurt, kombucha, all the other things that have,
Yes,
some kind of bacterial components, right? But you're dropping the dark chocolate because you
dark
know
chocolate.
patients better than I do. I mean, if I had the dark chocolate nugget in my mind before, that would have been a pearl I would have run with. That's so
Yes.
and I do think with some of those pieces and patient stories in general, one thing I feel like, Jackie, that we have to be able to emphasize is sometimes pregnancy in general, first time pregnancies in particular, it can have some levels of embarrassment that are unnecessary to be embarrassed, but it's just kind of a natural response. I know for my wife, it was one, and not seeking help, or
Mhm.
asking for something. It is one thing that just to encourage, patients and pharmacists to be able to ask their patients how things are going, even some of the things that may be slightly embarrassing to make sure they're
Yeah.
being taken care of. I've seen just things get pushed off for too long and they become a
Mhm.
problem. And it's usually because of just that. We're worried to ask, or there's some fear of kind of judgment there. And I feel like as healthcare practitioners, I'm saying this to Jackie because in particular, she's made the transition to do this. And so she has a
Mhm.
champion behind it, is to ask those early questions, like ask those questions that someone might not think to ask, in general. Do you
Mhm.
have anything else in that constipation space for pharmacists in particular, or pharmacy technicians that they should be asking their patients when they're picking up their meds or when their family member is picking up their meds to be able to check on them, they're doing well?
I think it's always just keeping it as an open line of communication, making sure that pharmacists are asking those open-ended questions, so that way people aren't just closed off to saying, "Nope, we're good. Like I don't have anything." So making sure that they know that you are a resource there, that you do have the knowledge to help them, and then that they can call you at any time with any questions they may have.
Love it. Yeah, nothing more important than building true relationships. I think that is
Mhm.
absolutely fantastic, Jackie. Thank you for all your sage wisdom and for your time on here, Jackie. Everybody, thank you so much for joining us. And if you want to reach out and be able to connect with Jackie or Jenna or myself, you can head over to RPH Ally, join the channel there, and learn more about Perfecting Peds and all the fun stuff that they are doing and changing the world with. So we will talk to you guys soon. Have any questions, let us know.
Thank you so much. Have a good day.